So how do you know when you've got diabetes? What are the signs and symptoms? With type 1 diabetes, it usually presents as a medical emergency. People generally fall ill, and they feel quite sick, they feel tired, lethargic, they might have an abdominal pain, they might actually vomit as well, and generally feel there's something completely unwell. They go to the doctor and they find out they've got type 1 diabetes and require insulin immediately. For type 2 diabetes, the onset is more slow and insidious. People sometimes suffer from type 2 diabetes for years and don't even know about it. And the reason is some of these symptoms come on very slowly. So some of them include a loss of weight over months and maybe years. A lot of people that have type 2 diabetes say that they started feeling thirsty or hungry more often, or they started going to the toilet and urinating more often. In addition, some actually complain of blurred vision that took them to the doctor and then they discovered by chance they had diabetes. Also, cuts that don't heal or wounds that don't heal well may be a sign of having diabetes. A general feeling of lethargy or lack of concentration and interest may be other signs of having type 2 diabetes. People with diabetes can't actually, unfortunately, get rid of the illness completely for now. And so the mainstay of treatment is actually trying to maintain blood glucose levels at a normal level in order to avoid complications and to avoid hyper and hypoglycemia, which is the increase or decrease, extreme increase or decrease of glucose in the blood. So how do we do that? For type 1 diabetics, of course, insulin is the mainstay of treatment, and it must be taken either as multiple injections every day or through an insulin pump. For type 2 diabetes, there are various medications that can be taken, and potentially insulin could be a part of that treatment regime. In addition to all these, people with diabetes have to focus on other areas of their life to improve the levels of diabetes in their blood. For example, maintaining 30 minutes of moderate intensity exercise every day is very important. In addition to this, maintaining a healthy weight is very important, and the avoidance of being overweight or obese.